you mentioned, and the next crisis, which, yeah, we're definitely familiar with that one too, the 2008 credit crunch. So tell me about going into that and like really, how things had to change or what did change.
Yeah, what happened was our company was listed. We were a public company, and a merger happened. So the company was essentially bought, and for me, it became part of a large organization. And for me, I've been obviously running it, part of it for 8 years. It was that time to think of other things as well. So at that time, it was 2008, I decided to take a sabbatical, essentially go and live somewhere else. So I moved to France for a bit. And and I decided to do some non-profit work for a while. So do something totally different. I still felt my real passion was still in the field of personalized medicine. And I felt in 2008, because when we started in 2000, it was a term you couldn't really use. Having individualized medicine per person, that just didn't make sense. It was hyped, but by 2008 it was a bit more accepted, but I still felt more work needed to be done for that to become a reality for everyday patients and people to access it. I felt still more needed to be done. So I did some non-profit work and became executive director for a European think tank called the European Personalized Medicine Association. And I did that for about a year, which was really interesting because I learned actually at that time that there are fantastic new tools that we develop in the labs and that we can actually try to get onto the market. But for patients, from actually normal citizens, to have access to these fantastic new diagnostic tests and new personalized treatments, there was still a lot of information they didn't have that could make sense to them. For them, it's very hard to understand. And for example, this when I moved actually into the area of cancer, for a cancer patient, there's so many different options, and it's so hard to understand why you receive one treatment and not another, and why your neighbor who has similar type of cancer gets a totally different treatment. I felt there are great tools out there, but people, citizens, patients don't know why they should perhaps ask for one or another, and they find it quite hard as a result to also ask the right questions to their care teams. And in the process of sort of working there, I started to toy with ideas, and I said, well, let me talk to a friend of a friend who'd been diagnosed with cancer, because in my field, in my direct environment, I didn't know any cancer patients. So I spoke to this friend, and she'd been diagnosed with breast cancer. And that's really when I heard that she really did not know why she was receiving her treatment. She found out far too late that her surgery hadn't gone right. So she was walking around still with tumor cells around in her body. That was written down in the report, but no one had effectively told her. And that she thought she was receiving treatments that no one else was receiving, and she couldn't talk to anyone about this. And she felt incredibly isolated. And when I went on to this sort of this little search, a field search essentially that I was going on to, I just realized that she was highly traumatized, and that she really didn't know what was happening to her and where she should go for help. So that's when actually I came up during that time with another idea, and that became the second venture. So yeah. What happened next was actually, I was more frequently traveling back to the Netherlands, and I started to chat to my brother. I have two brothers, and one of them is a medical doctor, and he has a specialization which is called clinical occupational physician, specialized in cancer. So he helps cancer patients with the rehabilitation and with their return to work. He advises them if they've been on particular treatments and they lost sensitivity, people lose sensitivity in their fingers, he finds them the right profession, the right job with with the employer they're with. So he really supports cancer patients that way. So we were chatting, and actually I'd hardly sort of, we spoke every 6 months or every 5 months or so. So we were talking about this, and he said, yeah, I thought about my friend. And then he said, yes, I see patients in the waiting room, particularly breast patients, because he was running the Pink Ribbon Breast Clinic in the Netherlands at the time, particularly for the return to work side. And he said, I see them in the waiting room with their mobile phones, and they literally ask me, help me with this phone in my hand, help me get my life back. And so essentially we started to chat, put two and two together, and we said, we really have to start making apps, mobile apps. I just bought an iPad, let's make tools, mobile apps that's for people with cancer in a very smart and personalized way, because that's where I came from, to give people the right information at the right time. And so this was back in 2010 then. So that's when we started to toy with this. And in 2012, we started a new venture. So we did more field research, toyed with a lot of different concepts. 2012, I started PX Healthcare, and PX stands for Patient Experience, all with the idea to develop mobile tools for people, particularly with cancer.